My name is Lisa Greenwald, and I'm a family nurse practitioner at Schuylerville Family Health, which is a service of Saratoga Hospital. What I'm finding with looking patients up is that we have a fair number of elderly patients who are seeing several other providers, specialists, and we don't necessarily always have the ability to know who those providers and specialists are and what medications they've been given. So it's a great advantage to be able to see that prior to the patient actually having a face-to-face encounter with me. Using HIXNY in order to kind of follow up on our patients that are on chronic narcotics and chronic controlled substances. What we're finding is that some patients are extremely good with taking the medications as prescribed and not coming to other providers. However, we have those patients, and HIXNY has allowed us to identify them. We had a patient come in last week who was apparently seeing two separate providers for duplicate medication. And without the HIXNY system, I would have been able to identify that. So when she came in, I was able to access the portal, look her up, and realize that she was getting the same prescription from not one but two primary care providers. So that enabled us to confront that situation right up front and make the decision that we were no longer going to prescribe that because of fear of overdose. Allowed our nurses to save a great deal of time in that patients normally call here for prescriptions and the chart has to go through the doctor, then to the nurse to call the pharmacy, and at this point I'm able to get that request and fill the request myself without having to bother the nurses, which frees them up to have a lot more patient encounter time. I use HIXNY for patient safety when patients are seeing multiple providers and getting new medications ordered by those providers. We've had problems in the past prior to instituting the HIXNY with patients that have been ordered medications and we're unaware of it, and potentially we're prescribing other medications that may interact.